What we now get a chance to do while we work on our cardiovascular fitness is to actually hear more about where we're going and where we see ourselves needing to be, but in that sort of really optimistic space, and maybe some challenging questions there too. And to take us into that space about, well, what really is this future, this bright future we're hoping for healthcare across our diverse environments. The person who's going to take us there is Professor Jeffrey Braithwaite. So Jeffrey, would you like to come down and share where you think we're going? Thanks, Jeffrey.
Thank you, Ursula. So thank you very much. Thank you to the International Hospital Federation. Haven't they done a fantastic job? And here in Australia, our own AWHA. So thank you, Alison and Eric and both your teams for putting together a fantastic, fantastic Congress. And to Paul Dugdale for the initial invitation to me to come and give a talk. I'd really like to thank them, but should I? The last person? The last session? After you're exhausted for 3 days? Should I thank them? Thanks, guys. That's an Australian, thanks, guys, which indicates a slight curl at the lip for being the last person. By the way, I'm always worried about audiences on the last day, last session. Which are you? Are you desperate and dateless? Or dedicated and driven? Exactly. The desperate and dateless, they're not here, or they didn't go woo, woo, woo just then. I'm going to talk about the future. I'm going to talk about healthcare systems, future predictions for global care. And I'm going to do that by walking through a couple of issues, or quite a lot of issues, in fact, trends and ideas that have been well canvassed, in fact, to date. And in a way, what I hope is this is a capstone for all the other things that people have been doing. I hope that's where we reach. And then we're going to have a panel facilitated by the fantastic Ursula. Has she been doing a good job or what? Don't clap her too prematurely. She's going to come back into your life. So let's have a look at this idea. Firstly, I come from the Australian Institute of Health Innovation. We're a group of researchers, about 170 people in Sydney, Australia, at Macquarie University, and we do health systems research. My joke is we don't splice genes or cure cancer. We do something much more complex than that. We try and figure out how the health system works, and through our research, underpin how health systems can work better. So we're not in a lab cooking up new proteins or something like that. We're doing the health system here and internationally, and that's our little motto. So we've got 3 research centres. My own research centre, by the way, if you want career advice, don't come to me. I managed to get to be head of the institute and to run one of the centres in the institute. And my colleagues, Professor Enrico Cholera and Professor Joanna Westbrook, they run 2 other centres. And this is what we do. This is the title of the centres. And I say that not because I want to advertise the institute, although I am the director and, you know, there's always a bit of marketing here and there, is there not? But what I want to do is say, if your work maps to some of these people, for example, if your work maps to implementation science, come and talk to me. Or if your work maps to big data and health informatics, go and talk to Enrico Cholera. Or if your work maps to epidemiological views of safety and aged care and other parts of the health system, go and talk to Joanna. So, I'd like to thank another bunch of people. I'd like to thank a bunch of people who contributed to this book that I'm going to talk about. To the editors, authors, and support teams around the world who helped us do it. So we're going to dedicate this talk to them. Now this is them. Is your country represented here? But that's only the first page. Here's some other people we're acknowledging. who contributed to this work. That's only the second page. Here's some other people who contributed to this body of work that I'm going to represent to you shortly. So, let me start this way. You know about the story about John Snow and cholera, don't you? You did that when you did your undergraduate degree, or your master's degree, or your PhD, or you heard Professor McNeil earlier this morning. The story of John Snow is very interesting. There were 3 outbreaks of cholera in London in the 1800s. In 1854, 10,000 people died in London and Newcastle in the UK. Nobody knew yet about the germ theory of disease. It was a disease of the poor. There was one water pump at the corner of Cambridge and Broad Street in London. You can go there now. And there were 500 fatal attacks of cholera in 10 days. And John Snow discovered that the answer was in the water. So what's the message? There are many messages for John Snow's story. The first epidemiologist and the first person who really called our attention to how we need to look for solutions, not necessarily in the places where we think they are. Sometimes, the message for me about John Snow is sometimes look in the places you least expect to find the answer. So to find the answer about the future of healthcare, to find the answer about where is healthcare heading, what might it look like in 2030, I've been leading a series of 3 books on international health reform. And it's taken up a fair chunk of the last 5 years of my life. The first book was Health Reform, Quality and Safety, which looked at what's the relationship between all the activity in hospitals and elsewhere on quality and safety and the national health reforms that go on in every country. And we invited 30 countries each to contribute, low, middle income, high income countries to contribute to that book. The next book, Health Systems Improvement Across the Globe, I now invited 60 countries, low, middle income, high income countries, to all tell a story, a success story in their health system. I did that with trepidation. What about if there was countries where they didn't really have much success? But every country could tell a success story. Because we've got health systems, and although we complain about them, they actually do many, many marvelous things, and we've heard that during the last 3 days. The third book is the one I'm going to concentrate on, and that's Healthcare Systems, Future Predictions for Global Care. This time, I invited 152 countries, each to contribute a chapter looking at what's the future of your health system. What's the future of your health system? What's it going to look like in 5 to 15 years? That's the book. They're all on Amazon. So what will health systems look like in 5 to 15 years? And Ursula's challenged me. Is it going to be an optimistic story or a pessimistic story? Even if you've just met me, you've probably worked out I'm a raving optimistic extrovert. So probably it's going to be an optimistic story. You may well be right. So we looked across the regions of the world and we synthesized the perspectives from 152 countries and territories across the world. This is a doorstopper of a book. But luckily you've got me. You know why you have professors, by the way? You know why you have professors? So they can do all this reading and all this research and summarize it in half an hour in a few PowerPoint slides, so you don't have to do the reading. So next time in your country you find a pompous professor, tell him or her. Don't be pompous, I know what your purpose is. So we took 48 contributing authors covering 152 countries and territories, low income, middle income, high income countries, and we asked them to look at their health system, maybe a case study or a particular thing that they were doing, a policy, a practice, a study, a case example, identify the main changes needed to secure lasting improvement across the next 5 to 15 years, and develop a solution set for us, with the aim of telling other people in their country about their success story, but also with the aim of telling the rest of the world about what was happening in the next 5 to 15 years. But let's say to 2030, roughly, 12 years' time. So what lessons can we take from this global outlook of the future? There's 5 trends shaping health systems of the future. Now, there's more trends than that, but we found 5 recurring trends shaping health systems of the future. And they've been canvassed during the last 2.5 days. Sustainable health systems. How do we create sustainable health systems given all the costs that are coming down the pipeline, hurtling to meet us that we'll have to pay for? The genomics revolution. How do we do precision medicine? How do we create equity in a world where some people will afford the benefits of genomics and some people won't? Emerging technologies. We've heard a lot about that. Not just IT, information technologies like the keynote speaker this morning, but all sorts of new drugs and technologies that are going to get a faster diagnosis, better care, less harm, more improved treatments to the populations that we all serve. Global demographic dynamics. That's just academic speak for saying people in the modern world are on the move, with a visa or without a visa. And they're going to be more intensely on the move in the future. And that will play an interesting game across countries who have to deliver care to the people who are in their country. And then new models of care, and we've heard much of that, especially in terms of the hospital changing over time to deliver care in different ways. The idea of the right care to the right person at the right price in the right place. That sort of, can we get the right model of care for the right delivery to the right patient and patient population? So those are the trends shaping health systems for the future. But now I'm going to summarize what each of the chapters did in one series of 9 themes, and this is they. There were 9 themes if we look right across the book. And now I'm earning my keep for you, my dear audience, because I'm summarizing this book. You may never therefore need to buy it, and I'll never be able to retire on the proceeds. How dumb is this? So these are the 9 themes that we've assembled out of looking at this 500-page book with all these chapters. Integration of healthcare services. Getting more joined-up healthcare. Financing, economics, and insurance. How are we going to afford all the care that we have to deliver in the future? We can barely afford it in some countries now. Patient-based care and empowering the patient. Universal healthcare. Even some countries that got universal coverage in their system early, some countries are moving away from that now. They're charging patients a copayment. They're charging people private fees, even though there's a publicly funded system underneath the care that's being provided for the fees that are being charged. So how do we get universal healthcare? Obviously, WHO is working on that as we speak. Clinical information technology. That's really clinical and information technology. Clinical technology, information technology. Aging populations. How do we cope with the tsunami of aging populations? Japan, Switzerland, and some other countries, France, are leading the way in aging. They're going to have to face what we all have to face faster, and therefore they're good case studies. Preventative care. Accreditation, standards, and policy. In other words, can we help to orchestrate better care top-down through approaches like, in this country, the Australian Commission on Safety and Quality, 10 standards and policy. A word on policy, though, I don't want to editorialize everything in the book, but a word on policy. Some health systems I know have 2,000 policies in operation right now. Can I just say, that's dumb. If you've got 2,000 policies, you've probably got about 1,600 policies too many, because no one on the front lines of care knows those policies. So I don't know why you keep inventing more policies, just as an aside. If you're a policymaker, sorry if I've disappointed you. Accreditation, and then human development, education, and training. Now, when I think about preparing for this talk, and then I went through an experience like you did the last 2.5 days, it occurred to me that many of these things are being canvassed already across the last 2.5 days. So this is really synergistic. I think we've got this huge book which looks at global care and where we're heading, and already most of these ideas were canvassed in the last 2.5 days. So I think we're getting a meeting of minds about what the future might start to look like. And we never had that before. We didn't have that 5 years ago. So well done, IHF and AHHA, for bringing us together and developing a fantastic Congress that's canvassed, in my view, all the main issues that we face. Just briefly, I want to just deal with each of those in turn and just show you some pictures of the world. These are the 8 chapters in the countries, plus the region of Central and Eastern Europe, that dealt with the idea of integration. So if you're in one of these countries or you're interested in integration, in this book, these are where those countries tackled that particular issue. Financing, economics and insurance, there was 5 chapters, and the whole region of Africa, because there's not enough money in Africa to pay for all the care that they'd like to deliver. Patient-based care and empowering the patient, these countries in their chapters tackled that issue. 8 chapters, 14% of the total in the book. Universal health care, by the way, I know everybody's tackling all of these 9 themes, but these were the particular themes that these chapter writers chose to analyze their problem in their health system. 3 chapters, 5% of the total, plus the region of Central Asia. Clinical and information technology, 10 chapters, 18% of the total, and you'd expect that. Look at how we've talked during the last 2.5 days about the hospital, technology, primary care, how we're going to join everything up, how we're going to create data for people to make good decisions. Aging populations, a couple of countries, especially Japan, Australia, a couple of other countries, and the reason is the need for care for older patients, because they're going to have a need for more care as they age. That's something I've noticed about you, by the way, my audience. I've noticed that you're aging. It's not your fault. It's also not humorous, even though you laughed. And as you age a bit more, my prediction is you're going to need more and more care. I hope you age well, but you will sooner or later acquire all those comorbidities and other things that older people than us are facing, and you'll need more care. If that's not enough reason for us to all to work concertedly to create a really good health system by 2030, I don't know what is. Preventive care, we know an ounce of prevention is worth a pound of cure. 3 chapters looked at that, plus the region of Southeast Asia, looking at how, our minister 2.5 days ago, was it only 2.5 days ago, Alison? Seems like a couple of weeks, a lifetime, says Alison. She can't wait until drinks finish and the sundowner ends and she doesn't have this to worry about. She'll be dancing with the koalas. So those countries tackled this idea that our health minister said, if you remember 2.5 days ago, he said the best hospital admission is the one that never happens. That's really good for the patient. It's really good for the system. And then accreditation standards and policy, that's a big one. Everybody's working on how do we have good standards, how do we do external evaluation of our institutions and our services, how do we get better policy in place. Note to self, better policy might mean less policy in some health systems that I know, not more policies. 9 chapters, 16% of the total, tackled that particular problem, plus the region of Middle East and North Africa, MENA. And then finally, human development, education and training. One of the things I've learned in the last 2.5 days, or was reminded of a message, that, we can talk about technology, we can talk about hospitals, we can talk about walls, we can talk about wards, we can talk about high tech, but really, what we work in is a health system that needs trust and compassion and skilled humans delivering care to other humans in need above all. And that's not the 9th about human development, education and training of our workforce. That's really the first point for me. That's the starting point. How do we build in better care and better caring for our patients? So that's a quick summary of the book. And the result was, if your country is in grey and isn't coloured, then I do apologise. There are 190 countries in the world, and we covered 152 in this book. So if you're in grey, my apologies, I couldn't get to you to enable you to write a chapter. But as you've seen, there's always another book. That is a problem, of course, for me. The first book was on quality and safety and national health reform, 30 countries. The second book was on success stories, 60 countries. The next book was the future of health systems, 152 countries. So my question, audience, is what's next? Have I run out of work? I could find life on other planets, have an intergalactic book, health systems intergalactically, or I could add more countries and have a fourth book on something or other. I'm open to invitations. Tell me what you think is the next book, and I'll see if I can get the team together again to work on it. I could have done a lot of case studies, but a quick one is Australia, because we're here, and I'm kind of Australian. I'm kind of a dual citizen, really. I'm a dual citizen of the country that's currently figuring out how to divorce Europe and also Australia. So here's a case study from Australia where we're looking at, in this chapter, how do we cope with the shift from a complex acute system in hospitals to community-based care, and how do we identify frail elderly people and where they should be treated best? Japan, the Netherlands, and Qatar also contributed chapters because they are worried, especially Japan, about the aging population that they're facing. So if you want a case study, there's a nice case example. And if you don't want to buy the book, I can put you in touch with the authors. Just send me an email. So, Ursula, you said I had to sort of summarize and be optimistic. So what have I derived from all this work with all these chapter writers and all this intelligence writing and analysing health systems for 5 years or more? What have I surmised? Well, I've surmised what's the health system of the future going to look like if we get it right? What will the features be? These are the features. It needs to be more inclusive and equitable than today. Equity, for example, is a big problem because healthcare is going to get more costly. I know we talk about being more efficient, but it's going to get more costly. New things have to be paid for. How do we deliver equitably the share of the health system's benefits to vulnerable populations? It has to be more integrated, and we've heard that a lot. My colleague over there, Yvonne Zarinsky, is obsessed. Is that too hard a word, Yvonne? Is that a descriptive word or was it a punitive word? Obsessed with the idea of how do we get more integrated care. Patient focus, we've heard that. But how do we really do that? Can we really look ourselves in the eyes? Can we look ourselves in the mirror and say, we run patient-focused, patient-based healthcare? Or is it there for the benefit of the provider, at least a bit, maybe a lot? More evidence-based. Of course, I'm self-serving here. I'm a researcher. I get grants. I do research. But having a more evidence-based hospital and health system is going to be very important in the future. Applies technology wisely. The things coming down the pipeline to us are scary as anything. What we've got coming down the pipeline is genomics, AI in medicine, precision medicine, new machines that go ping and diagnose you faster than ever. We've got new drugs coming. It's awesome. But can we apply that technology wisely? Can we pay for it all? Are we prepared to pay more taxes or higher health insurance premiums? These are questions that we have to get right if we're going to have the health system in 2030 that we would like to have. And it has to be cost effective. In short, we think, and the idea coming out of these books is we have to run a learning system. Because at the moment, you know what? The health system isn't a learning system, it's a forgetting system. We forget things. Things happen in one part of the system we don't even know about in another part. And longitudinally, we forget about the last project we did. How do we amalgamate all the knowledge? And I was talking to Paul Dugdale, and he's got some ideas about internet scraping to try and collect the knowledge about innovation for the benefit of whole swathes of people. And there was a wall on innovation out there in the exhibition hall. So we're going to have to get really to have the characteristics of a learning system rather than today where we are a forgetting system. Improvement has got to be in the DNA of reformers. At the moment, there's a lot of people in healthcare who kind of do a good job and they're doing okay and, you know, they're running the system today, but actually we've got to run a much better system tomorrow. We need far-sighted people who are going to continuously improve healthcare across time. Right? Right, Kate? And how many more minutes do I have? Hang on. She's just doing the calculation as we speak. 6 minutes. 6 minutes. Am I going to deliver to the AHHA and IHF on time and on budget? This is extraordinary. Alison said, you're delivering on time and on budget. This wasn't optional. We're going to have less waste. And if we do that, waste in healthcare, it's running at probably about 30%. Duplicate tests, procedures that should never be done, administrative costs. We're going to have to save some money out of that waste to deploy, to deliver less harm than we do now, to deliver more evidence-based care. And we're currently working on that big time in my institute and with people right across the country, right across the world. Universal care, I worry that some countries don't have universal care, but some countries have universal coverage and they're walking away from it. By stealth, almost. We need universal coverage for all 7.6 billion people on the earth. A civilization, one of its hallmarks is delivering good care to all its citizens and especially looking after its vulnerable populations. And finally, a health system of the future is going to have a roadmap for change. And this book is part of that. And the deliberations we've had over the last 2.5 days are part of that roadmap, understanding where we're going. So, the key message is, this is a comprehensive and encouraging look at the future. It helps get us move towards progress versus us deliberating about and arguing about the current health system. That's not where we should be spending our energies. We should be spending our energy trying to deliver a better health system with a vision for the future. It helps us, this book and other things that we've discussed in the last 2.5 days, to identify and avoid pitfalls in the system, because there's lots of roadblocks, there's lots of pitfalls. You know that. You'll go back to them when you go back to your health system. It creates, this book and the sort of work we're doing here, and also the work we're doing in my own member-based organisation, the International Society for Quality in Healthcare, which I'm president-elect of, Esquire. It helps us to create a roadmap. And I think that's where we are now, at the intersection of trying to create a roadmap to positive and sustainable change and positive and sustainable health systems. So there you go, Ursula. I am an optimist after all. You were correct when you introduced me. So we've also been doing something else, and in the last couple of minutes, if I may, timekeeper, we've been running a questionnaire survey, and Yvonne and Dr. Kate Charuka and Zayad over there, who are my colleagues, have been helping with this. We've been saying, well, what can crowd wisdom tell us about producing a sustainable health system? We've been tapping into your ideas. So we asked participants through the survey that was on your app, your Congress app, and before the Congress, running up to the Congress, starting here in Brisbane, we asked, in which country do you work, what's your gender, what's your age, what's your main professional role? And we asked questions like this. We asked your opinions about the sustainability of healthcare systems. Questions like, what are the main attributes of a sustainable healthcare system? What indicators would you monitor to make sure that your health system was sustainable? If you could change one thing about your health system to improve its sustainability across time, what would that be? In which country has a healthcare delivery system that you hold in high regard when you think about its sustainability? And do you have any other thoughts? And we'll be publishing this in due course. And we've tapped into many of you, and we even made the inducement that we would give you a prize if you participated and you'd go into a draw. So, what did we find? 52 responses, 41 were from Australia and 11 other countries. Note to everyone from outside of Australia, please fill in the questionnaire. It's on your app because we'd like to bolster the numbers from other countries. The other countries are listed there. There were 21 males and 30 females, and one person was undeclared, halfway between male and female. We don't know. Other, they ticked the other box. So we weren't quite sure. 13 were researchers or university academics. You can't stop them doing a good old questionnaire survey, can you? 9 were policymakers or government officials. 5 were doctors. 5 were hospital managers or CEOs. 4 were nurses. 2 were allied health staff. 2 were goods as a services supplier. 2 were health consumers. 14 were other again. Did they tick the other box? These others are interesting, aren't they? We might do a sub-analysis. See how I'm a researcher? I can't help being a researcher. What I'd point out is we've got a good cross-section and representation, but we need more responses. So please fill in the app, fill in the questionnaire survey in your app. So here's some answers. This is what we found. In your opinion, what are the three main attributes of a sustainable healthcare system? This is what they said. Skilled workforce, provides needed care, accessible, affordable, provides value. Already we're getting huge synergies here between the talk I just gave, based on the book for the future, and the things we've been discussing at this Congress. What three indicators would you monitor to assess healthcare delivery system sustainability? And this is the answers. Patient outcomes, patient satisfaction, workforce satisfaction, costs, and value. We'll give a copy of these results to you in due course. If you could change one thing about your health delivery system to improve its sustainability, what would that be? People said reduce fragmentation. In other words, create more integrated care. Improve the workforce, providers and managers, those people who deliver care to patients. Increase quality of care. Use data. We heard about that. That's a theme right the way through the last 2.5 days. Increase customer focus, consumer focus, and increase affordability so that groups with less income, less money, less wealth can access care in their country. So if you haven't had a chance to complete the survey, we will keep it active until Friday, the 19th of October. That's next Friday. Just go to your Congress app, and there it is, and you can fill it in for us, and we will spread the results through the IHF and the AHHA. So we had a prize. We drew amongst people who had completed the survey. It's too late if you're now on your app trying to fill this survey in. Bad luck, it's all in the timing. The prize is, can you believe this? The prize is an Australian food and wine hamper available from the Deeble booth, but now we've got it in the room, have we not? And more important than a wine and a food hamper of Australian food, a signed book on health reform across the world. Does it get better than this? There's the book, and there's the hamper that you may have won. The winner is Kim Field from New South Wales. Where are you, Kim Field? Thank you. Kim Field, let me read the endorsement. Dear Kim, we've only just met. Dear Kim, congratulations on your prize. Happy reading. With very best wishes, Jeffrey.